Brought to you by Agilus Diagnostics.
Agilus Diagnostics.
Before we start with another episode of Doc Talk, don't forget to like, subscribe and share. Heart disease, which is a major health issue in India, affecting over 60 million people and causing about 28 to 30% of all deaths. The rise in cardiovascular diseases is due to high blood pressure, diabetes, smoking and sedentary lifestyle, along with rapid urbanization and dietary changes. Strokes, which are common among heart patients, with around 4,800 people suffering from strokes every day. To help us understand the impact of strokes, the risk factors, prevention and management, we have an expert with us today.
I am Dr T.S. Kler. I am Chairman of Cardiac Sciences at BLK Max Heart Institute in Central Delhi. Today we are going to discuss the problem of stroke in patients with heart failure. But basically heart failure is a syndrome which is kind of occurs because the heart is not capable of meeting the demands of the body as far as the cardiac output is concerned. So heart failure is of two types. One is heart failure with decreased ejection fraction. That means the pumping capacity of the heart is decreased because of some damage. The second entity is the heart failure with normal ejection fraction. These are very two different entities and they have very different treatment. Primarily the symptoms of heart failure are breathing difficulty or tiredness, not able to perform your physical activities, and also there is a swelling on feet, on body, and patients will have cough. Particularly if these patients have the cough while they are lying down, which gets better on sitting, this should be always considered as a cardiac cough and should not be taken lightly. Now, as far as the India is concerned, our own country, now the main reasons for heart failure are hypertension, coronary artery disease. Coronary artery disease means यहाँ की हार्ट वाली नाड़ियों में ब्लॉकेज आ जाते हैं. Then diabetes is very important reason. Then we have also a rheumatic heart disease where the valves of the heart get affected. Though the incidence of rheumatic heart disease is decreasing, but still in India many states which are relatively poor, there is significant amount of patients with the rheumatic heart disease. And there is another entity which is called heart muscle disease. We call it cardiomyopathy. So these are the main kind of reasons of heart failure in India. Now the main thing which people should understand that we have a lot of capability, lot of opportunity to prevent heart failure. If we treat the blood pressure in time effectively, if we treat diabetes effectively, if we decrease our weight, do some regular exercise, we don't smoke, and we learn how to manage our stress in life. So these are the factors which can decrease the incidence of heart failure to a very, very tremendous levels. Now another thing which I want to tell you that patients with heart failure, they are at a higher chance of stroke. Now why stroke occurs in these patients? Because of two reasons. One is that patients with heart failure, they develop atrial fibrillation. That means where the heart rate becomes irregular and fast, the upper chambers of the heart don't contract, so there is a stagnation of blood in the left atrium which can go to the brain and cause paralysis. So atrial fibrillation is one important reason for stroke in heart failure patients. The second reason is that the patients where the heart is damaged, it's ballooned out. There are some areas of the heart which are not contracting enough. It's a scarred area. So in those areas also there is a stagnation of blood and clots can form, and these clots, if they go to a brain, they can cause paralysis. So how to prevent this stroke in these patients? First of all, we should be very, very attentive in these patients about their rhythm. If they have atrial fibrillation, it must be treated effectively either with medication or we do what is called as electrical cardioversion, or some of the patients we do radiofrequency ablation. So as far as possible they should be back to normal rhythm, number one. Number two, we give them drugs which will prevent clot formation in the left atrium. We call it anticoagulants, they are very effective to prevent incidence of a stroke in these patients. So when we go to the source, the left ventricle itself, if we know that there are areas of the heart which are not contracting, if somebody has a aneurysm, if somebody has even a suspicion of clot in the left ventricle, these patients should also be on proper anticoagulation to prevent the chances of stroke. Well, when we call stroke usually means cerebral stroke, दिमाग की प्रॉब्लम है. हालांकि कई लोग हार्ट वाले को भी हार्ट अटैक को भी स्ट्रोक कहते हैं, लेकिन इन जनरल स्ट्रोक मीन्स cerebral or brain stroke. So people will have usually either some part of the body not suddenly stops working. They can have for example, one right upper limb, right lower limb not working, or they can have a speech problem, or sometimes they can have a balancing problem, or sometimes they can have a sudden appearance of visibility problems. So they can't see the things properly. So it depends upon the area of the brain which is involved. So the signs and symptoms usually will depend upon the area involved, and usually most of the time they are on one side of the body. So any of these symptoms, if it occurs suddenly, a person should understand it may be a stroke, and one must go to the emergency of the nearest possible hospital where stroke management is possible, because if we treat stroke in the earlier phase, we can prevent total stroke. Now we have the methodologies, either blood clotting agents, or we can even sometimes do intervention in these patients, and we can prevent stroke in these patients. But the most important thing is again that these people should go to the emergency as soon as possible. In the closing message to people of this country, I will say that we have a lot of incidents of heart failure in our country, and unfortunately the incidence is increasing because of increasing incidence of hypertension, diabetes and heart disease. Not only this, also we are having more people to live longer. So the age is also increasing. Because of these reasons, we have a lot of heart failure. And the best way to deal with heart failure in our country is at least we should adopt all the preventive philosophy, preventive measures, so that we don't have to spend millions and millions of dollars on this disease. And also I want to emphasize that heart failure for a common man means that patient has died. No, heart failure doesn't mean death. Heart failure only means that the heart is not in good shape. Fortunately, there are a lot of therapies available these days, so we can treat the causative disease and heart failure can improve. We can, in patients who have advanced heart failure, we can give them artificial heart, which is called LVAD. We have the capability also to give a new heart, which is called heart transplantation. So fortunately, all these modalities are right available in India. So one should not get totally disappointed. There is a lot of hope for these patients.
Heart disease and strokes are significant health challenges, but with the right knowledge and lifestyle changes along with following expert advice, we can effectively manage and reduce these risks. That's all for today. Keep watching Doc Talk on Fit Tak.